My name's Heidi. I'm a director and esthetician dermal therapist at the Skin Corrective Centre, and today we're going to be talking to you briefly about anti-aging home care. So when you come to the Skin Corrective Centre, we like to know a little bit more about you and what you currently use on your skin, what results you would like to see and how quickly you'd like to see them. There are a lot of treatments on the menu of services that we can provide, lots of different skin types. The results that you're looking for will then determine the treatments that we often choose. The best way to answer this question would probably be to look at what your key concerns are. And for a lot of people, it is aging. So what we need to look at in the skin is where does aging occur mostly, and that's deep within the skin tissue in the dermal component. And unfortunately, a cleanser's probably not going to be the most anti-aging product in your home care regime. Neither is a moisturiser. So you cleansing and moisturising and thinking that that would be giving your best chance at minimising fine lines and wrinkles would probably not achieve the outcome that you were hoping for. The best way to see changes, structural changes in your skin, is by, yes, preparing the skin properly with a cleanser. Maybe that cleanser would be more advantageous to be alpha hydroxy acid or beta hydroxy acid fueled, so having an active ingredient in your cleanser to ensure that you've got the complete removal of dead skin cells. Because guess what will happen if you achieve that? You will get a beautiful absorption of whatever vitamin, mineral or active ingredient is that we put on second to that. And to evoke change in the skin, vitamin C's, once they dermally saturate the skin, can resynthesize collagen production. But a huge one that we all agree on, from aesthetic work to dermatology to GPs to cosmetic physicians, is vitamin A. And vitamin A can be in the form of retinol, retinal or retinoic acid, and they all achieve a very similar outcome in the skin. So vitamin A is a huge one. There is also epidermal growth factors and DNA repair enzymes that work really well on changing the DNA structures inside the cell so that the likelihood of mutation and developing skin cancers is kept to a real minimum. And that's what we like to see change at the Skin Corrective Centre. The skincare product ranges that we stock at the Skin Corrective Centre are all cosmeceutical grade skincare. So the products that we stock and the combinations of active ingredients that are within those product ranges all evoke change on the skin, and that's what we want to see. We want to see your skin change structurally. So among those active ingredients that are within the ranges that we stock, some would include alpha hydroxy acids, retinols, which are vitamin A's, and they can be retinols, retinoids and retinoic acids. Vitamin C is a really common active ingredient that we start with. Peptides, epidermal growth factors, DNA repair enzymes, beta hydroxy acids, and other forms of nourishing oils or occlusion barriers that keep in all of those beautiful active ingredients. A lot of us know that we need to wear sunscreen, but it's very hard for people to decipher which one is going to be best for their skin, keeping in mind that often at the Skin Corrective Centre we're treating lots of different skin conditions and concerns. So you may want to place a sunscreen on your skin that is suitable for your rosacea or for your age spots, or that's going to interact well if you've got acne or problematic skin. You might get watery eyes or itchy eyes from most sunscreens. So understanding what's in the tube is so important. And at the Skin Corrective Centre, we really feel as though it's important to have a really high physical reflective content in your sunscreen and a low or no chemical component. So just as an example, when you're choosing your sunscreen, if you were to decide that you wanted to be as healthy as you could possibly be in terms of food choices, and you went into a supermarket and you saw 2 baskets and you needed broccoli, and one basket said, this broccoli has been chemically treated with chemical pesticides in one basket, and the other basket had chemical-free treatments associated with the growth of that piece of broccoli. Which would you choose if you were trying to lead a healthy lifestyle and be as kind to your body as possible? You would probably choose the organic option. And that's what we're trying to provide people with at the Skin Corrective Centre, is skincare that has all of the nasties taken out of it, so you only get the absorption of the vitamins, the minerals and the active ingredients that are going to be serving their purpose. Some of these ingredients, or just some of these chemicals that may not be kind to a skin with concerns, would be ingredients like octamethoxydibenzoyl methane, octamethoxycinnamate. If you turn around your tube of sunscreen, more often than not you will see a lot of chemical blockers as the active ingredients. We like to use high zinc oxide content and high titanium dioxide content because those active ingredients are good for the skin, they're kind for the skin. And if we're going to be performing fractional laser resurfacing, medium depth or light depth epidermal peels, if we're going to be doing eye peel, photo rejuvenation on your skin, we're less likely to recommend you go home and use a chemical and physical blocker on your skin versus just a beautiful physical blocker sunscreen.